dedicate years of their lives to becoming physicians. Along the way, they're balancing long hours, emotionally difficult patient encounters, family responsibilities, financial stressors, and also constant pressures to learn and perform. As GME professionals, we can't eliminate those challenges, but what we can do is help create an environment where trainees feel supported. When residents and fellows feel supported, they're better able to learn, provide safe patient care, and then thrive throughout their training. Hello, everyone, and welcome back to GME Compass. I am Dafny Argueta, Chief Education Officer and co founder of GME Compass. Today, we're going to talk about what to do when a resident or fellow doesn't seem like themselves and how each of us can play a role in supporting the mental health of our residents and fellows in GME. We have no financial disclosures. Content shared by GME Compass is based on our own personal experiences in graduate medical education, and they reflect our own professional insights. As GME professionals, we spend a lot of time supporting the residents and fellows in their professional development. But sometimes the biggest challenges isn't related to academics or accreditation. Sometimes it's recognizing when a resident or fellow simply doesn't seem like themselves. That can leave us asking, should I check in? Should I let the program director know? Am I overreacting? Should I just stay out of it? These aren't easy questions, and there isn't always one right answer. I think it's important to understand what our role is as a GME professional when it comes to supporting residents and fellows in their mental health. Some wonder whether supporting residents and fellow well-being falls within their role at all. Others feel like they have to fix every problem that a resident and fellow brings to them, not expected to diagnose depression, anxiety, or burnout, or any other mental health conditions. And we are certainly not expected to counsel residents and fellows throughout personal struggles. But we are often people that the residents and fellows interact with every day. And then over time, many come to trust us because those day to day interactions, we often notice changes that others may not see right away. We notice their patterns, we build relationships with them, and we may be one of the first people to be able to recognize that something doesn't seem right. And our role again isn't to diagnose, our role is to notice, support, and then also help connect the residents and fellows with the appropriate people and resources. Supporting residents and fellow well-being isn't just about helping an individual. When residents and fellows feel supported, they are better able to learn, provide safe patient care, high quality patient care, and then also thrive throughout their education. And that's why residents and fellow well-being is a shared responsibility across the entire GME community, and why every one of us has an important role to play. Rather than trying to identify a mental health condition, what you want to do is pay close attention to changes. Again, you're not looking to diagnose, you're simply noticing when someone's unusual behavior has changed. Has someone who is normally responsive suddenly stopped answering emails? Has a resident who's usually engaged become like withdrawn? Are they missing conferences or arriving late more frequently? Do they seem unusually overwhelmed and distracted or emotional? One isolated incident, to be clear, doesn't necessarily mean that something is wrong, because we all have difficult days. It's when those changes become persistent or they become out of character that they deserve a little bit more attention. The question isn't what's wrong with the resident. The better question is something different than usual? If you have established relationship with your residents or fellows, check in with them privately. It doesn't have to be complicated. It could be something simple as, hey, I've kind of noticed that you don't seem like yourself lately, and I just wanted to check in and see how you're doing, if you're okay. You're not there to solve the problem, but you're simply trying to open the door. The third is communicate. If you don't feel comfortable, which is fine, approaching the resident or fellow, or you're concerned about what you've observed, share those with your program director. Focus on what you've noticed, not what you think could be causing it. Like, for example, I've noticed that, you know, Dr. Argueta seems more easily frustrated than usual and is behind on several tasks, which, it really isn't like them. Are they okay? I just wanted you to make aware, to see if you're able to check in on them. Sometimes, most of the time, Definitely in my cases, when I've had to bring something up to my PDs, either in fellowship or in residency, they already notice the similar changes and actually even know what's driving those changes. Other times, our observations help the program directors recognize a larger pattern or, put that piece together. Either way, you have helped to ensure that the resident isn't carrying this burden alone. Know your institution's wellness resources. Know who your residents and fellows can contact. Know the process if someone needs additional support. Your job is to help connect them to it. Sometimes we underestimate the impact of simply noticing that someone is struggling. Don't ignore your observations because you're afraid of being wrong or your instincts. Don't make assumptions or try to diagnose someone. Don't gossip about your concerns with colleagues. Don't promise complete confidentiality if you're concerned about someone's safety. If you're concerned a resident or fellow may be in immediate risk of harming themselves or others, follow your institutional policies and notify the appropriate individuals immediately. Don't assume someone else has already noticed. Sometimes one caring observation is what starts the conversation. Before we wrap up, let's recap the three biggest takeaways from this episode. First, know your role. You don't have to diagnose, counsel, or solve every. Second, trust what you observe. You're not looking for a diagnosis. You're simply paying attention to meaningful changes in someone's unusual behavior. And then finally, don't underestimate the impact of speaking up. You may not be the person who provides the help, but you may be the person who starts the conversation that again leads someone to it. Supporting residents and fellow well-being is a shared responsibility, and every member of the community has an important role to play. I hope this episode has made you feel more comfortable about how you can support resident and fellow well-being. If someone doesn't seem like themselves, don't ignore it simply because you're afraid of saying the wrong thing. Maybe it just means checking in. Maybe that means sharing your observations with your program director. Or maybe it simply means reminding someone that they're not invisible. Small moments of compassion can have a lasting impact, and we should never underestimate the difference that we can make. Until next time, keep navigating GME with confidence.